Namaste, I am Dr. S. Jayaraman. I am a consultant pulmonologist working in a Sri Jayam Chest and Sleep Clinic, Bilroth Hospital, Apollo First Med and MGM Healthcare. November 20th every year, as per the WHO, they do the awareness program for the COPD, World COPD Day, November 20th. You all know very well chronic obstructive pulmonary disease. This comes under the obstructive airway disease. Is one of the important common disease encountered in our practice. COPD is the second leading cause of death in India. As far as the mortality rate is concerned, next to heart attack, the lung attack. Lung attack is nothing but any COPD exacerbation, mainly the infective exacerbation, we call it as the lung attack or COPD exacerbation. COPD, the main etiology behind, you all know very well, tobacco smoking and the air pollution. Air pollution carries a major risk factor to develop COPD, and tobacco smoking causes second major risk factor for the chronic obstructive pulmonary disease. The disease usually exhibit after the age of 40 years, and the symptomatology more or less same as asthma. Cough, mostly dry cough. Sometimes you can get the expectoration and breathing problem in the form of a whistling sound. And every year they have a theme for World COPD Day. This year World COPD Day 2024 is Know Your Lung Function. Know Your Lung Function is the theme of World COPD Day 2024, November 20th. The importance of the lung function is a very important way to assess the lung function by using the spirometry. Spirometry is a pulmonary function test, PFT. This is an important test to clinch diagnosis of obstructive airway disease. Not only obstructive airway disease, we can diagnose all the diseases by doing the spirometry. So in the spirometry, we do the lung function measurements in the form of lung volumes and lung capacities, FEV1, that is forced expiratory volume in 1 second, and forced vital capacity, and the ratio between the FEV1 and FVC, and the small airway function as FEF 25, 50, 75, and MEF. We do a lot of lung function assessment, and we do the DLCO also. Rarely we do the oscillometry. Oscillometry is also one of the important lung functions coming up in a rapid way. So oscillometry we can diagnose accurately for the children and extremes of age group. Those who are not able to do spirometry, we can go ahead with the oscillometry. This is an impulse oscillometry, forced oscillometry techniques. We can assess the lung function even in the normal tidal volume breathing. So lung function measurement is an important disease to stage the disease correctly, whether is it a mild, moderate or severe. So based on the disease, we have to prescribe the medications. The standard care of management for COPD is the awareness of pollution, awareness of tobacco smoking, etc. And we have to give the proper inhaled bronchodilator is a cornerstone of treatment. And sometimes we used to give the inhaled corticosteroids also, and we have to give the periodical measurement of lung function and periodical vaccinations, all important. So every year we do the COPD awareness activity. Such a common disease we come across in our practice, the second leading cause of death next to heart attack. So COPD awareness is very important. We have to keep our environment very clean, neat. So avoid pollution is the important thing. Take your messages for everybody. So with that, I thank you very much for the wonderful opportunity. Thank you.